Good morning. We're going to operate a case today. Like last time, we've discussed about pterygoid implants. Another case of all on 12, 6 implants in upper jaw, 6 implant in lower jaw, some anterior front tilted implant, and a pterygoid implant. The discussion about this case and the specific point which I want to discuss about is the timing of implant placement. The patient we are operating today is quite young, my friend. I'm operating this patient at the age of early 50s. So early 50s is very early age for a normal patient to get a full mouth implant and full mouth restoration. So the timing of implant placement, when we should place, depends upon what are the dental condition, what is the local bone condition, what are the remaining teeth which are there in the mouth, are they going to help us for longer time, and how many teeth which are disease prone, which has a disease and which requires extraction for either reasons, for periodontal reason, that is a bone loss, or because of the caries we lost a lot of teeth. So particularly this case is a periodontal patient. Periodontal patient is a tooth loss or a mobility in a teeth because of loss of bone, because of a disease around the disease of a gums and a bone which are holding your teeth together. This patient is pre-diabetic, the patient is a smoker, and he has shown me his condition and worried about his mobile teeth since at least 5 to 6 years. He's coming to me reluctant. That early age, I suggested him since the beginning that you'll require extraction and you'll require a full mouth implant rehabilitation. Obviously, it's difficult to accept at a very early age that I'll require a complete extraction and I'll require a full mouth rehabilitation. My teeth will be gone and I have to, whatever it is, patient do consider it as it's a denture, it's a complete denture. It is not complete denture, it is a fixed teeth. Okay, the function is as close as possible. Still, patient was reluctant, and I could have done a more simpler implant placement then. Simpler implant placement means straight implants, fewer implants in a native bone where the teeth were holding. Now what I have to do is I have to tilt a lot of implants. Tilting is not a problem, but it makes the things little more complicated, and I have to go behind and put an implant into pterygoid plates. Pterygoid plates are great site for placing the implants, but it cannot be the primary site. It is the area where we fix the implant when the primary area, which is the bone which was holding the teeth, is not available for any reason. Now the guy is 50-year-old. I've already am placing some compromised implant, some implants in a little compromised bone. So there are great chances that in future, because he has long life ahead, we may require one more implant situation where the implant, either of the implant, some of the implants are failed, and we will have to go for some rescue implant into the zygomatic bone. This could have been avoided by deciding early and placing a normal implants in a more healthier and the quantity wise more amount of quantity in the bone of a bone. With quantity and lot of missing teeth, quality of the bone also reduces. So I'm placing the implant in a more thinner and shorter bone compared to a more longer and thicker bone, which was possible some years back if the decision was taken early. Sometimes hanging on to the teeth and delaying the treatment for implant is not good. It's detrimental. Sometimes it's definitely required, and definitely we try that we push the dental extractions and placing the implant as long as possible. We want natural teeth to be there, but sometimes hanging on to the natural teeth is not helpful. In this case, early extractions and placement of the implant would have been much helpful for the patient for longer run. So I'll be putting the graphics and the design somewhere on the screen and explaining you. So I will be putting 4 implants in a front area in a compromised bone, but fortunately I can place to 4 long implants. Tilting is not a problem in a modern implantology, and then we'll be placing 2 pterygoid implants. Lower jaw, the bone is fair. We can place 6 implants, which is ideal. 6 implants we can put. Upper 6 also, which are good. But this situation and the longer span between the 2 implants and this condition may cause a future problem. That doesn't mean that this is a wrong plan. This is the plan which we would have given to any of the patient of any age of this bone condition. But considering patient's age and longer he has to maintain and use these implants, this is not an ideal situation. This could have been avoided by just early decision. We'll be operating now. We'll be starting. We are all set. Thank you very much.